Hello everyone. So let's understand about the bioceramic sealer. So as we know, bioceramic sealer is a dicalcium and tricalcium silicate based bioactive material. Now what is bioactive material? Bioactive material is a material which helps in the repair, regeneration and healing of the tissues. Okay. So coming to the setting reaction, as we know that bioceramic sealer is hydrophilic in nature. That is, it requires a moisture for the setting reaction. So what happens is when bioceramic sealer comes in contact with the tissue fluids or the moisture, it forms the two components. That is, first calcium silicate hydrate and the second is calcium hydroxide, which dissociates into calcium and hydroxide ions. Now each ion has a specific function. Calcium ion will help in the healing and mineralization, whereas the hydroxyl ion, because of the high pH, it will cause an antibacterial effect by eliminating or killing the endotoxins produced from the bacteria. Now, coming to its properties, the very important property of bioceramic sealer is bioactivity. What is that? Bioceramic sealer, when comes in contact with the tissue fluids or the phosphate fluids present in the tissues, it forms a hydroxyapatite, which will help in the dentine bridge formation or a hard tissue formation by mineralization of the hydroxyapatite. Okay. Number two properties is superior sealing ability. Why? Because it has a nano size particles of less than 2 micrometer, which will cause a better penetration into the dentinal tubules, which will help in the better chemical bond and thus will have a better sealing ability than the other comparable sealers. Then the third property is slight expansion. So a slight expansion of 0.1 to 0.3 is required. Why? Because during the setting reaction, there is a release of these ions, which will help in the bioactivity of the material. So a slight expansion is important. One more important thing is this slight expansion, unlike the resin cements which shrinks on setting, the expansion helps in the filling of the microscopic gaps. Then it stimulates the repair and the regeneration. It is biocompatible. It means that if extruded, it will help in the periapical healing. But the extrusion should be small or slight. It has a low solubility of less than 3% by mass. The low solubility will help in the dimensional stability of the bioceramic sealer. Now, coming to a very important limitation of bioceramic sealer, we can remember it by the mnemonic bond. So, these features are somewhat the reason for the difficult retreatability or difficulty in removing these bioceramic sealers from the canal.